Blood flow through individual organs is controlled intrinsically in response to local tissue requirements. This phenomenon is called autoregulation. When the true capillaries are flushed with blood, exchanges occur between the capillary blood and tissue cells. Your goals for learning are to explain the importance of autoregulation, to list the chemical and physical factors that serve as autoregulatory stimuli in the various tissues, to describe the means by which various solutes are transported across the capillary walls, and to explain the factors that determine the amount and direction of fluid flows across the capillary walls. Here's what you need to know. The structure of a capillary bed and the definitions of mean arterial pressure, diffusion, osmosis, filtration, and exocytosis. To see definitions of terms, click the bold red words. Autoregulation is the process by which the various organs and tissues of the body self-regulate their blood delivery. This process can be compared to water flow regulation from a local water system. A pumping station pumps water to individual houses via water pipes, just as the heart pumps blood to individual organs via blood vessels. Within each house, the residents can regulate the amount of water entering the house according to their needs. As long as the water pressure remains normal, they can get water anytime they want to. Similarly, as long as mean arterial pressure is normal, the various organs and tissues of the body can regulate the amount of blood that enters them according to their needs at any given time. Blood flow regulation occurs at the capillary beds. The feeder arteriole brings blood to the capillary bed. The shunt is a short vessel that directly connects the feeder arteriole and the drainage venule at the opposite end of the bed. Exchanges of materials take place between tissue cells and the blood in the true capillaries. The precapillary sphincter is a cuff of smooth muscle fibers that surround the root of each true capillary, acting as a valve to regulate the flow of blood into the true capillaries. Click on each box to see what happens when precapillary sphincters are open or closed. The buildup of certain chemical signals locally acts as a metabolic control that causes the feeder arteriole to dilate, bringing more blood into the local area. These chemical signals also cause the precapillary sphincters to relax. The buildup of certain chemical signals locally acts as a metabolic control that causes the feeder arteriole to dilate, bringing more blood into the local area. These chemical signals also cause the precapillary sphincters to relax. For the following screens, click on the box showing the condition in tissue cells that you think will cause the precapillary sphincters to open in most tissues. Local physical factors acting on the vascular smooth muscle, such as changing blood volume and blood pressure, also act as autoregulatory stimuli. Click on each box to see the effect of changing blood pressure and blood volume on the local capillary bed. We will now look at how materials are exchanged between the capillaries and tissue cells. The true capillaries are the sites of solute exchanges between the blood in the lumen of the capillaries and the tissue cells. Several structural characteristics of capillaries aid the transport process. Capillary endothelial cells have fenestrations, which are pores that may be open or covered by a very delicate membrane, allowing for passage of fluids and small solutes. Clefts between cells also allow movement of materials between the blood and tissue cells. Cytoplasmic vesicles move materials across the capillary wall by bulk transport. Most solutes move across the capillary wall by diffusion, which is the movement of solutes from an area of higher concentration to an area of lower concentration. Lipid-soluble molecules, such as oxygen and carbon dioxide, diffuse through the lipid phase of the intervening plasma membranes. Click on an oxygen or carbon dioxide molecule to see these gases moving across the blood vessel wall. Some molecules which are not lipid-soluble are translocated by cytoplasmic vesicles in a process called exocytosis. Click on a yellow molecule to see exocytosis take place. Water-soluble solutes, such as amino acids and sugars, diffuse from the capillary through fluid-filled clefts or fenestrations. Click on a blue molecule to see how water-soluble solutes move from capillaries into tissue cells. We will now explore fluid flows at capillary beds. Bulk fluid flows, which have little to do with nutrient and gas exchanges, also occur at capillary beds. Note the fluid leaving the capillaries at the arterial end and returning to the capillaries at the venual end. Bulk fluid flows are important in determining the relative amount of fluid in the blood and in the tissue spaces. Interstitial fluid, including any plasma proteins that have escaped from the bloodstream, enters the lymph capillaries. These leaked fluids and plasma proteins are carried back to the bloodstream by the lymphatic system. As the amount of fluid in the tissue spaces varies, the distance that solutes must travel between the blood and tissue cells changes proportionately. If there is more fluid in the tissue spaces, solutes must travel farther between the blood and tissue cells. Fluid flows represent the balance between hydrostatic and osmotic pressures acting at capillary beds. Let's look at just hydrostatic pressure first. Hydrostatic pressure is the pressure exerted by a fluid on the walls of its container. In capillaries, hydrostatic pressure is exerted by blood. Thus, capillary hydrostatic pressure is equivalent to the blood pressure in the capillaries. Capillary hydrostatic pressure is also called filtration pressure because it forces fluid out of the capillaries. Because of friction encountered in the capillaries, the capillary hydrostatic pressure is lower at the venual end of the capillary bed than the arterial end. In theory, the hydrostatic pressure of the interstitial fluid in the tissue spaces opposes the hydrostatic pressure in the capillaries. Normally, however, there is very little fluid in the tissue spaces because it is quickly picked up by the lymphatic capillaries, so the hydrostatic pressure of the interstitial fluid is very low. Net hydrostatic pressure equals the hydrostatic pressure in the capillary minus the hydrostatic pressure in the interstitial fluid. The net hydrostatic pressure forces fluid out of the capillary. Let's determine the net hydrostatic pressure at the arterial end of the capillary bed. Taking the capillary hydrostatic pressure of 35 millimeters of mercury minus the interstitial fluid hydrostatic pressure of 1 millimeter of mercury gives us 34 millimeters of mercury for the net hydrostatic pressure at the arterial end of the capillary bed. Now let's determine the net hydrostatic pressure at the venial end of the capillary bed. Here, 15 millimeters of mercury minus 1 millimeter of mercury gives us 14 millimeters of mercury for the net hydrostatic pressure at the venial end of the capillary bed. Now let's look at osmotic pressure. Osmotic pressure is the pull on water exerted by large non-diffusible solutes like proteins. The higher the solute concentration, the more the solution pulls or holds water. For each beaker shown, note the relative concentrations of solutes in the sac and in the bathing solutions. Then click on each beaker to observe the net movement of water in that system. The movement of a solvent, such as water, through a membrane from a dilute solution to a more concentrated solution is called osmosis. Because of its high content of plasma proteins, capillary blood has a relatively high osmotic pressure which tends to draw fluid into the capillary, like the first sac on the previous page. Interstitial fluid contains few proteins because leaked proteins, like leaked fluids, are quickly gathered up by the lymph capillaries. Hence, interstitial fluid osmotic pressure is very low, 3 millimeters of mercury in this example. Net osmotic pressure pulls fluid into the capillary. Net osmotic pressure equals the osmotic pressure in the capillary minus the osmotic pressure in the interstitial fluid. In this typical capillary, the capillary osmotic pressure of 25 millimeters of mercury minus the interstitial fluid osmotic pressure of 3 millimeters of mercury results in a net osmotic pressure of 22 millimeters of mercury. At the arterial end, will fluid leave or enter the capillary? Remember that the net force, which determines the direction of flow, equals net hydrostatic pressure minus net osmotic pressure. The net force at the arterial end of the capillary equals 34 millimeters of mercury minus 22 millimeters of mercury, which equals 12 millimeters of mercury. Since the net hydrostatic pressure is greater than the net osmotic pressure at the arterial end of the capillary, the hydrostatic pressure wins out and fluid leaves the capillary at the arterial end. At the venial end, will fluid leave or enter the capillary? The venous net force in the capillary equals 14 millimeters of mercury minus 22 millimeters of mercury, which gives us negative 8 millimeters of mercury. Since the net osmotic pressure is greater than the net hydrostatic pressure at the venial end, the osmotic pressure wins out and fluid enters the capillary at the venial end of the bed. Here's a summary of what we've covered. Local chemical and physical factors regulate blood flow to individual tissue cells. Lipid-soluble substances move through capillary walls by diffusion, whereas non-lipid-soluble substances are transported via pores or exocytosis. Clefts and fenestrations facilitate the process. The fluid flows occurring at capillary beds reflect the balance between hydrostatic and osmotic pressures acting inside and outside the capillary. To test your knowledge, click the quiz button to go to the